Good morning. Good afternoon. Oh, I forget what time it is.
Oh no, I just need to start the video on this. Thank you.
Second up, Doc. Is it one yet? Who's moderating?
Kelly.
You ready? Well, good afternoon, everyone. I want to start by thanking Philadelphia residents and business owners for their patience and understanding as we navigate this unprecedented situation. As of 8 a.m. this morning, our new business activity and stay-at-home order is in effect. We've heard from folks that they still have some questions, so I'd like to take a moment to clear a few things up. All Philadelphia residents must remain home or at least their place of residence unless they are engaged in essential personal activities that are spelled out in the order. Essential personal activities include things like seeking medical care or assistance from law enforcement and emergency services, reporting to and performing a job related to an essential business, caring for a family member or other individuals at a separate location, delivering essential goods or services, moving in or out of a home or apartment, picking up food at a grocery store, school meal site, or a restaurant, though ordering ahead is now required for these establishments, transporting a child to comply with shared custody agreements, certain outdoor activities such as walking, running, cycling, or operating a wheelchair while using appropriate social distancing rules. We are optimistic that all residents will recognize the severity of the situation and will voluntarily observe the new order. As we've said before, we are painfully aware of the stress and potentially devastating impact that these closures are causing for businesses and workers across Philadelphia. We understand the pain of this, but it's really critical that we do it. We would not take this action if it wasn't completely necessary in the interest of public health, your public health. As we all work to triage the situation, we wanted to provide support for businesses and workers as soon as possible. Philadelphia's small businesses are the backbone of our city's economy, and our new relief fund will help some of them navigate the COVID-19 crisis and retain as many jobs for workers as possible. Today you'll hear from Acting Commerce Director Sylvie Gallier-Howard and Ann Nevins, President of PIDC, about the Philadelphia COVID-19 Small Business Relief Fund. Before we do that, I wanted to reiterate that there are resources available for workers who are feeling the impact of this crisis too. Right now on phila.gov/COVID-19, we have a blog post that details many of the resources available, including information on Philadelphia's paid sick leave policy, details on unemployment compensation, and much more. I want to thank our partners, including Philadelphia Works, for helping to compile and maintain that list. In addition to the Philadelphia COVID-19 Small Business Relief Fund, which Sylvie and Ann will share details about in just a moment, we are also taking action by instituting some short-term tax relief. The city is extending filing and payment dates for real estate and some business taxes. We will honor the federal extensions granted to business from the IRS for filing and payments until July 15th, 2020, for the business income and receipts tax and net profits tax. This policy includes estimated payments. For commercial and residential property owners who are unable to pay their real estate tax by March 31st, the Department of Revenue has extended the deadline to pay an additional 30 days. To date, for 2020 real estate taxes is now April 30th, 2020. The deadline to apply for an installment payment plan for 2020 real estate tax has also been extended until April 30th, 2020. Taxpayers who can file and pay their taxes by April 15th, 2020 are strongly encouraged to do so. This will help ensure continuity of city and school district operations. On another note, the Philadelphia Parking Authority last week started relaxed enforcement at meters and kiosks. Unfortunately, some folks have started ignoring other parking restrictions, including loading zones. This is serious because it is hampering the delivery of essential goods, including food. So a reminder, while the PPA is not enforcing kiosk and meter parking violations, they are enforcing and ticketing for safety violations, like blocking fire hydrants or parking in handicapped spaces and loading zones. It is important that people not block any fire hydrants and not block any loading zones or other restricted parking areas. As the son of a firefighter, a former firefighter, parking against a fire hydrant is really unconscionable. And tradition has it that firefighter will find a way to get that hose through your car, and it may require replacing a couple windows. It is vitally important that motorists park legally and not block access for emergency or other vehicles providing life-sustaining supplies. Unfortunately, if they do, they will be towed from fire hydrants and loading zones. In addition to this positive news for Philadelphia taxpayers, I also want to share an update on the Blue Cross Broad Street Run. After much consideration, the city and race organizers have decided to postpone this year's Blue Cross Broad Street Run. At this time, we don't know how long the impact of COVID-19 will be felt in Philadelphia or what additional measures we may have to take. So in the interest of race participants, staff, and all our residents, we've opted to push the 2020 race back to October 4th. I want to assure participants that their registration will automatically transfer to the new date. No action is needed on their part. But if they would like to transfer their bib or defer until 2021, they can do that at no cost. The normal fee of $15 will be waived. The Broad Street Run will be updating their website with an FAQ to answer many of the questions I'm sure folks have right now. And you can also email info@broadstreetrun.com. That's info@broadstreetrun.com. Now Dr. Farley will provide you with the latest update on the number of cases in Philadelphia and the actions we are taking to keep the spread limited. Dr. Farley?
Good afternoon. Thanks very much for joining. I'm going to give you an update on the latest information on the spread of the coronavirus in Philadelphia and what's happening with the healthcare system. Since 1 p.m. yesterday, there have been 79 new cases of coronavirus infection reported in the city, bringing us to a total of 175 since the beginning of the epidemic. You may notice that that's a large increase from the number of cases that were reported over the weekend. We expected there would be an increase because many laboratories did not report data over the weekend. So much of this is just reporting the backlog. For example, yesterday we received a total of 79 results, positive and negative. Today we received 577 results. But still, this increase represents evidence of further spread of this virus in the city of Philadelphia. And remember now that there's a delay between when people are exposed to the infection and when we ultimately get a positive test result. So our test results reflect spread that happened about 12 days ago, and we have to assume that there's been quite a good deal of spread since that time until today. So we expect that there are many more people in the city of Philadelphia with this infection now. I'll give you more details on the 175 people that we know have this infection now. Of those, 8 are under the age of 20, 89 are between the ages of 20 and 39, 42 are between the ages of 40 and 59, and 36 are age 60 and up. Of that total, 14 are hospitalized. 2 of those are age 20 to 29, 2 are age 40 to 49, 5 are age 50 to 59, and 6 are over the age of 60. And of that 175, 21 are known to be healthcare workers. If you want to follow the spread of this epidemic in Philadelphia, you can go to the city's website, www.phila.gov/COVID, and under the section of what the city is doing, there's a graph that will report out each day the number of new positive test results we have. Let me talk a little bit about testing now. The testing availability is going to be present this week. It's going to be less than it was before. There's reduced ability because there's a shortage of test kits in laboratories and a shortage of, test kits are taking the sample and a shortage of laboratory testing capacity. More and more laboratories are receiving samples from around the country and they're being overloaded. Now, most large healthcare providers still have testing sites now, but because of the reduced availability, they have strict clinical criteria for who they're going to test. There is one new site that will be opening today, and that's a site in Rite Aid at 7401 Ogons Avenue. This is specifically for healthcare workers and first responders only. Healthcare workers and first responders only at 7401 Ogons Avenue, open today 9 to 5 and should be 7 days per week. We at the health department will be posting guidance today about people who are interested in getting tested on our website. That guidance will talk about who does not need to be tested, who should not be tested, and for those people who do need to be tested, how they can go about doing that. That guidance will probably change pretty frequently. It may change every day as the situation moves quickly. General principles are here. If you don't have any symptoms, or if you have symptoms that are not characteristic of this infection, you don't need a test. If you have no symptoms, you do not need a test. If you have even the characteristic symptoms, but you are young and otherwise healthy, you do not need a test. That test is not going to help what would be treatment be given to you. If, on the other hand, you have these symptoms and you're having difficulty breathing, then you should go to an emergency department to see if you need special treatment within a hospital. Now, if you have symptoms of fever and a dry cough and you still want to test, you should contact the provider where you last received care. Call ahead first or connect them with them over the internet first to have a conversation. That testing may not be appropriate, it may not meet the criteria, but if it does, then they can give you instructions on how to get the test. Now, the Department of Public Health, as you know, has a site at Citizens Bank Park that we've run for the last few days for people who otherwise should get a test and couldn't get it elsewhere. Otherwise, yesterday we tested 141 people at that site, of whom 71 were healthcare workers. The site is scheduled to be open today from 1 p.m. to 6 p.m. The weather, you may have noticed, is pretty bad out there today. It's raining, it's windy. Our staff and the volunteers that are working there are willing to work in the rain, but if it gets so windy that the tents are blowing over or the rain is getting on their iPads and their paperwork, they may have to close the site down. So pay attention to the news. If we close it down, we'll let you know. Our criteria for testing continue to be first priority are healthcare workers who have symptoms, and then second priority would be people over the age of 50 with symptoms of fever and cough or shortness of breath. We will turn away people who don't meet our criteria. For those people who do meet our criteria, no appointment is needed. Just come on down, bring your driver's license and your health insurance card, which just helps us with information. It's at no cost. Let me just talk a little bit about testing more generally. In view of the shortages of the supplies and in view of the shortages of testing capacity, testing is becoming less valuable, so it will be less of a focus of our overall response to this epidemic. Testing is still important for healthcare workers. We don't want healthcare workers to be exposing their patients, and it's important for the care of patients who are in the hospital, but it's less important for others. And we are unable to test everyone, and so increasingly we're going to have to be clearer and tighter with our criteria for who the test should be given to. With the number of test positives coming out, there are increasing number of businesses and other organizations that are being notified that one of their workers tested positive. So there is guidance now on the website as to what an organization should do if they learn about an employee who has a positive test. If you go to this is the website, it says guidance for essential businesses and other organizations, and it walks you through the steps you need to take. Just reminders for everyone in the city now. Again, can't say it often enough, stay away from people. Wash your hands. Those are the two steps that can really prevent you from getting infected and prevent you from spreading infection to others. I want to thank everyone who's following that. The vast majority of people in Philadelphia are doing that. Everybody needs to get used to this. We're going to be in this situation for a while. I do want to note what the mayor said, that among the activities that are permitted is to go outside for a walk or a run or a bicycle ride to get exercise. Exercise is important to health. We have to maintain our health through all this. If you do it, though, make sure you keep your social distance for other people and go out just for that activity and then come right back. Okay, so you can do that. I encourage you to exercise, but keep away from people when you do it. In general, the website again, www.phila.gov/COVID or COVID-19, either one works. And if you have medical questions, 1-800-722-7112. Thank you.
Thank you, Dr. Farley, and good afternoon. Last week, we distributed at the school district more than 47,000 meals to more than 23,000 students. Parks and Recreation helped distribute another 8,000 meals, bringing us to more than 55,000 meals in total. As we have said many times before, we realize the role the school district plays in providing a safety net to many of our students, and we are pleased to be able to support so many students during this difficult time. As of today, we have expanded the number of district schools that are serving as meal distribution sites. We've expanded that number to 49. In order to minimize the number of days our families have to get out and pick up these meals, we've decided to reduce our meal distribution days to just Mondays and Thursdays, keeping our 9 a.m. to noon hours. On these days, each student will be able to receive a total of 6 grab-and-go meals, 3 breakfasts and 3 lunches. We're also stressing that several charter schools and Philadelphia Housing Authority community centers will serve as meal distribution sites as well. And we thank our partners across the city of Philadelphia who came together to make sure we could identify more sites to serve more children. We encourage people to visit our website at philasd.org, which links to the city's website, phila.gov, where information and schedules for all of the sites can be found. I want to reiterate also something that the mayor said earlier, that individuals, even with the shelter in place, are allowed to go to these sites to pick up meals. In addition to the meal site distribution updates, I want to remind families that the K-12 learning guides can be picked up at the 49 district schools serving as meal distribution sites. The next set of K-12 learning guides will also be available beginning Wednesday, March 25th, and that is when online copies will be made available. And paper copies will be available at all 49 district grab-and-go meal sites starting Thursday, March 26. The English language arts and math learning guides include daily lessons that will engage students for 10 days. We encourage students and families to finish the first phase of learning guides this week and begin lessons in the new guides next week. These guides can also be found online at philasd.org. We're continuing to offer support for families and students who have questions about the guides through a hotline. But as of today, we've expanded our efforts by adding 9 new hotlines in multiple languages. Families can use these hotlines to not only get information about the learning guides, but they can now also get answers to a range of general questions related to school closures. In addition to the current English language hotline, new ones are available in the following languages: Albanian, Arabic, Chinese, French, Khmer, Portuguese, Russian, Spanish, and Vietnamese. We know many families have questions, and we want to make sure we're reaching as many families in their native languages as possible. The hotlines will be operated from Monday through Thursday from 9:30 to 11:30 a.m. The different phone numbers associated with each hotline can also be found on our website at philasd.org. Lastly, we have also created an email address where families can send any questions they may have during this time. That address is covid19info@philasd.org. Once again, covid19info@philasd.org. We'll share as many answers as we can, and as always, we appreciate our community's continued patience and support as we try to navigate through these unprecedented times. And we want to reiterate that the School District of Philadelphia is here to help our students, families, and staff, and we will all get through this together. Please remember, you can always stay updated on the latest developments by visiting our website, philasd.org, or by following us on Twitter at PHLSchools and Facebook at facebook.com/PhillySchools. Thank you, and now I'd like to turn it over to Sylvie Gallier-Howard. Sylvie?
Thank you, Dr. Height. Hello, I'm Sylvie Gallier-Howard, Acting Commerce Director for the City of Philadelphia. We recognize that businesses in Philadelphia and around the country are especially impacted by the spread of COVID-19. They are facing an unprecedented challenge due to the ongoing global pandemic. To help provide some immediate support for our small businesses, today, the City of Philadelphia and PIDC are launching a COVID-19 Small Business Relief Fund. We are launching the COVID-19 Small Business Relief Fund with $9 million in City and PIDC funds. And I'm thrilled to report that we received word of an additional donation to the fund just last night. I would like to take this moment to acknowledge the Daniel B. and Florence E. Green Foundation for their generous $250,000 contribution to the fund. We know there are others who are interested in helping us grow the pool of available funds even more through additional donations. We welcome foundations and corporations interested in supporting the fund to reach out to PIDC. The fund will provide grants and loans to hundreds of selected small businesses in order to help cover critical expenses, such as payroll, and preserve jobs. The fund will be a tiered program with a mix of targeted new grants and zero-interest loans for businesses that make under $5 million in annual revenue. Tiers include micro-enterprise grants of $5,000 per business for businesses with less than $500,000 or $500,000 in annual revenue. Small business grants of up to $25,000 per business for businesses with annual revenue between $500,000 and $3 million. And small business zero-interest loans of up to $100,000 per business for businesses with annual revenue between $3 million and $5 million in annual revenue. Businesses can apply by going to phila.gov COVID/19/business/relief. There is one application for all 3 tiers. I also want to mention that the applications are available in English, Spanish, and Mandarin. And for our Spanish speakers, la solicitud está disponible en español. Applications, sorry, I don't speak Mandarin. Applications will be reviewed on a rolling basis. Priority will be given to businesses who demonstrate a loss of over 50% average revenue, a plan for recovery, and a commitment to retaining their employees as long as possible. Philadelphia's business community has already been severely impacted, and we must do everything in our power to ensure that capital continues to flow to small businesses during this critical time. Since this crisis started, not a day has passed that I haven't heard from business owners worried about their employees and how to pay the bills. Likewise, I have heard the heart-wrenching personal accounts of workers affected by layoffs. While the protocols taken are critical life-saving measures, acting quickly to help get businesses the funding that they need will help ensure that more businesses survive these challenging times and preserve jobs for our residents today and tomorrow. We have also compiled a list of existing resources for both businesses and workers, which can be found on blog posts at www.phila.gov/commerce. If businesses have questions during this difficult time, the Commerce Department's Office of Business Services is available to answer them. They can be reached through the Business Services Hotline at 215-683-2100. That's 215-683-2100. And they can email business@phila.gov. I do want to take a moment to acknowledge our team, the combined team at Commerce and PIDC that has been working around the clock for the last week 10 days on this program. They know that businesses and employees need our support more than ever and are committed to the mission of ensuring that Philadelphia has a strong economy and family-sustaining jobs for all. Now, in this moment, I'd like to bring up Ann Evans, our partner, who probably regrets being on speed dial on my cell phone. Ann.
Thank you, Sylvie. Good afternoon. I'm Ann Bovaird Nevins, president of PIDC, which is Philadelphia's Economic Development Corporation. The team at PIDC has been working hand in hand with our partners at the Department of Commerce to launch the COVID-19 Small Business Relief Fund to help get immediate support to Philadelphia's small businesses in the midst of this crisis. With this new fund, we are sending a message to the entrepreneurs and the small business owners across Philadelphia and to the many people who rely on these employers for their livelihood that we will do all that we can to support them during this unprecedented situation. In addition to this new fund, PIDC is continuing to offer our existing lending programs to small and mid-sized businesses to provide working capital, fund contract receivables, refinance higher interest debt, and meet other needs. We've been hearing since this crisis began from our many small business clients throughout every corner of Philadelphia. Even though we are operating remotely, our full team stands ready to put these much-needed resources to work and help as many people as we can right now. While the COVID-19 Small Business Relief Fund is an important start, we know that Philadelphia businesses will need more resources. I want to reiterate that what Sylvie mentioned, that we will continue to explore additional relief options for businesses of all sizes that are being made available through the state and federal governments, as well as our partner CDFIs and other sources. On that note, I want to make sure that everyone is aware that Philadelphia businesses can apply now for the Small Business Administration's Economic Injury Disaster Loans, which offer up to $2 million in assistance per business and can provide vital economic support to help overcome the temporary loss of revenue. We recognize that the economic impacts of this pandemic continue to change by the day and sometimes even by the hour. And we understand the importance that swift action can have in helping Philadelphia's businesses to survive and people to stay employed. We will continue to work closely with our partners here at the City of Philadelphia to provide resources to Philadelphia businesses as this situation continues to evolve. Thank you very much.
Thank you, Ann. And Sylvia, I actually do just want to commend your staffs as well. You all have been truly amazing to work and see move forward. Yes. We're happy to answer questions at this point. And please know that Sylvie will be available for Spanish language questions at the end of this event.
All right, like Brian said, if any reporters who are logged on have questions, please use the raise your hand function and we will unmute you when it comes time for Q&A. Please note, just because of the amount of press we do have on today, we will only take 3 questions from each outlet during this first round. So if there's time for additional questions, we'll circle back, but we ask that you do try to keep it to 3 or less. Thank you. Okay, first up, we have Jeff Cole. You are now unmuted.
Yeah, hi. 2 questions. First, for the mayor. Mayor, in terms of the stay-at-home order, certainly in Center City and some communities, it appears to be being followed today, and I think you're being helped out by a driving cold rain. But in other communities that struggle, including Kensington and in the neighborhood of Kensington and Allegheny, people are certainly on the street. They're certainly gathering. And what they've told us is that to make any money at all, they've got to be out here, and they don't have many places to shelter. What's your view of what's going on in struggling communities?
Well, I mean, struggling communities will struggle even more when people get sick and die. So we want to make sure that the police will engage groups of people. There won't be arrests. There won't be citations, but they will engage and try to move people on. This is not an exact science, and we've seen in other countries too that people have been reluctant to follow guidance. We'll continue to put that guidance out there. We'll engage our police in engaging these folks and try to get as many people off the street as possible. The more people we get off the street, the sooner we'll depress this curve and see our way out of this problem.
I just had one for Dr. Farley, if I could. Dr. Farley, you've said that there'll be less testing this week than last, and you've said that it's it's not quite as important possibly now as we move ahead. I'm wondering though if fewer tests being done limits in any way your ability to kind of track the growth of the virus in certain communities. And secondly, whether you've got any better idea now about when healthcare providers will get some of the PPE that they so apparently need so badly.
Yeah, so one of the reasons for testing is for us to be able to track the epidemics spread across the city, which we can useful for planning. I do think that there will be enough testing done in hospitals and healthcare providers dealing with people who are sick for us to be able to do that. We also have other mechanisms for tracking the epidemic across the city. For example, we get measures of how many people come into hospital emergency departments every day with respiratory complaints. We can use that tracker. As far as personal protective equipment, my understanding is that some of that did come into the city and is being distributed to healthcare providers across the city. I do not think that will be enough. I think we're still in a posture of a shortage, and healthcare providers need to conserve the masks and other equipment that they need as much as possible, and we'll continue to look for additional sources.
Thank you.
Okay, next we have Martin Pratt. You are unmuted.
Hi, this question is for the doctor. Wanted to check and see, are you going to allow walk-ups? A lot of our residents in financially insecure communities may not have vehicles. Will there be allowed walk-ups to the drive-thrus? And also, is there any thought or plan given to home kits?
Yeah, so there are probably more than 20 sites across the city where testing is available, and to going through a regular healthcare provider, you can do that, and almost all of those people can walk up. The one site in South Philadelphia was set up in a parking lot using standards that was given to us by the federal government. It's very difficult for us to accommodate walk-ups. We're seeing if that's possible, but it's not possible yet. But again, there are many other options. And,
thank you.
Okay.
Okay, next we have Sean with the Inquirer.
Thanks. Can you hear me?
Yes.
Can you give us an update on what's being done with the jails? And is there a possibility of releasing people who, based on the reason they're in jail, pose no threat to the public?
We had actually worked with our criminal justice partners last week to develop protocols for both the jails and the JJSC or our juvenile facilities. My understanding is those protocols are being followed, where there are individual petitions being filed with the courts, and the courts are making individual decisions on those issues. At this time, I don't imagine a broad or blanket release of individuals in either our juvenile or our adult populations. Our jails specifically have taken extra precautions, screening staff and contractors as they come to work to make sure that they show no symptoms, as well as increasing the quarantine time for people on admission from 5 days to 14 days. To date, we have no one in separate quarantine, so they have set up a quarantine facility on campus as well, and certainly are continuing to monitor these issues carefully to make sure that the health of both of our correctional officers and staff on site, as well as our inmates, are the utmost importance.
Thanks. Can you also update us on enforcement of the non-essential business shutdown order? Are there new notable cases there?
There aren't any notable cases. So LNI has received, I believe I reported earlier, 250 plus. That number has stayed consistent. We haven't seen any sharp increase. They have investigated about half of those and issued a number of letters to remind people that they need to close. That's an ongoing process, and happy to provide specific numbers later today.
Thanks. And for the mayor, could you tell us about your budget season with City Council would usually be beginning right about now? You just extended the tax deadline. Obviously, there's going to be huge revenue problems and spending needs. What are your thoughts about how to handle the budget going, in the months ahead?
I mean, at the moment, we're concentrating solely on this health crisis and trying to get, again, this curve depressed so that we can start to see our way out of it. As we emerge from it, we'll have a better idea of what we've spent in the course of this effort, what revenues have not come in, and where we are. And we'll evaluate that at the appropriate time. We can't speculate at this point how much this effort is going to cost or how it's going to affect the budget. There will certainly be a negative impact on the budget. It also has to do with what types of reimbursements we get from federal and state governments. And when we get all that sorted out, then we'll figure out how to adjust.
Are you worried the city doesn't have enough in reserves or fund balance now to weather the storm?
No, I think we have enough in reserve and fund balance now. It's just what happens afterwards. And I worry about everything every day, especially in this environment.
Thank you.
Okay, next up we have Michaela from Billy Penn.
Hi, everyone. Can you hear me?
Yes.
Awesome. I have a few questions from Billy Penn. The first probably for Brian. The stay-at-home order said all walk-in orders at restaurants have to cease, but drive-thrus can stay open. So what about walk-up windows at cheesesteak shops?
Walk-up windows would be considered, so we are asking everyone to order at a distance. So ordering at a walk-up window would also be prohibited.
Prohibited?
Yes.
Okay, thank you. And these two are probably for Dr. Farley. In the health department's guidance about when to get tested, are you guys considering adding loss of smell and taste to the list of COVID-19 symptoms? I know those were recently reported.
Yeah, I did see that recent report on that. I think that that's very nonspecific. It can happen with other illnesses, and I don't know that it's characteristic of this. So no, we wouldn't be looking to that. We're really looking at fever and dry cough, which is well documented as the two most common symptoms.
Okay. Have any or many Philadelphia coronavirus patients noted that as a symptom, or is it not something you guys are noticing yet?
It's not something that we collect information on, so I can't give you that answer.
Okay, thank you.
Okay, next up we have Jake Boombar with WHRY.
Hey, can you guys hear me?
Hey, Jake.
Hey, how are you? I've got a couple questions here for you. I'm curious about the construction industry in particular. Have you guys been seeing anybody, I know that they have till Friday to wrap things up, but have you been getting any pushback or any, anybody wanting to extend that even further? Because I've talked to some developers who say they need like 2 or even 3 weeks to button up their sites.
So we've heard some concerns from both from developers, from construction industry, from the trades. Like every industry, I think they're concerned about the impact on the business from this pandemic. On the timeline specifically, we've heard some concerns, and I think we will adjust as appropriate as we go forward. I think most can have their sites buttoned up by the end of the week. It is possible we'll make some exceptions as we get closer to the deadline, but we're not there yet.
Okay. And then in terms of conversations with the construction folks and with the trades, are there any talks right now about kind of building or attempting to build more space for more beds, basically, to kind of expand the capacity of the healthcare system if possible?
We've recognized the need to expand the healthcare capacity. We're working on a number of fronts to be able to do so. It's not specifically with the construction industry. That would probably be an existing facility. But we are continuing down that road.
Okay. Okay, that's what I got.
Great.
Okay, next up is Brandon Hudson from NBC 10.
Guys, how's it going? Hey,
Good.
can you hear me now?
Sure, Brandon. It's going well.
Hey, thank you. So, there's been talk of flash meetings on social media with those rumors popping up, as well as other types of crime as far as shootings go. What conversations have there been with Philadelphia police on trying to cut down on crime now that this stay-at-home order is in effect?
So we're in consistent communication with the police commissioner and her staff, and certainly we monitor social media just like everyone else does. And as we see flash meetings take place, folks should expect to see police officers attend those meetings as well. As I said yesterday, we don't want them to happen. Now is not the time for that, and certainly police will respond appropriately if and when they occur. As far as violent crime, I think you heard the mayor speak yesterday. I spoke about it over the weekend. You know, the violence in the city, it's unacceptable. We're continuing to deploy resources to our most violent areas, and many of the measures that the police commissioner undertook yesterday, or I'm sorry, last week, was in an effort to increase deployment of officers. And so they are more visible now in neighborhoods than they have been in the recent past, certainly more visible in our commercial corridors as businesses are shut down, and we are carefully monitoring any potential property crimes in our commercial corridors to see if any additional steps are needed.
We just saw the order that Governor Wolf was making a stay-at-home order statewide. Have there been conversations with him as far as if people aren't still staying at home, what may be the next step? Is it National Guard, more police, anything of that sort?
We're in consistent communication with the governor's office. Our chief of staff is speaking to his chief of staff. Our solicitor is having conversations with his general counsel on a regular basis. So I think we're in some very strong communication. At this point, I don't think neither he nor are we thinking those measures are necessary. You know, I believe in Philadelphians and believe that they are going to take appropriate measures to keep both themselves and their family safe.
And last question, 2 weekends ago, we had people out. They were out in public, out to bars and restaurants. So realistically, how soon are you hoping that people kind of get the message here that they need to stay home at all costs unless they need to be out?
You're going to hear us say it I think we have said it every day at this press conference for the last week plus. You're going to see us say it every day for the next several weeks as well. We are at over 100 cases at this point. We expect that number to rise, and we also expect this to be something that we are dealing with for a number of weeks. This is not going to go away, and we need your help to make sure that our healthcare system doesn't get overwhelmed. We need your help to flatten the curve, to make sure that those who need care can get it. And if we don't flatten the curve, our hospitals and healthcare systems are going to be overwhelmed, and people are going to get hurt or die. And that is what we're trying to do.
We come in here every day at 1 o'clock to give you these reports and give you these updates, and also urge people to be responsible citizens who live in a civilized society. I mean, we could bring the National Guard in, but there'll still be people that would be sneaking out. It's up to people to have personal responsibility, to understand that if their selfishness drives them outside, they're going to be responsible for somebody else's death. And that's really serious stuff. And some of these young folks who think they're invincible and want to party and do that stuff and go on the beach in Florida, they're coming back to potentially kill their grandparents and parents. So if they get that in their heads, perhaps common sense will prevail. But in a democracy, unless you want to, we're not China. We can't lock people up and keep them contained. I don't want to get to that point. But we're hoping that people will use their common sense and their lack of selfishness to do what's right and stop putting us all in danger.
Mayor Kinney, Mr. Abernathy, thank you for your time.
Thank you.
Okay, now we have Mike DOnofrio with the Tribune.
Yeah, I had a couple questions here. Can somebody from the administration tell me?
I'm smiling, Mike, because of your picture, not because of anything else.
Yeah, a Gmail account. Anyway, what is the difference between the city stay-at-home order and the shelter-in-place orders that other states have put in? Is it just different words, or is it the same thing?
It's mostly terminology. I've spoken a couple times about the term stay-at-home. The stay-at-home orders have been issued when the refinery exploded, certainly in an event like 15th Street in Tioga earlier this year, where we need people to take cover, to be inside quickly and for an imminent threat. And so we have been concerned about using the term and diluting it for future use because it is something that has a very specific meaning and one that we want to be able to maintain. But if you look at our order and what is covered in our order versus what's covered in Governor Newsom's or New Jersey's or New York's, all of the restrictions are generally the same. There are slight differences and modifications, but the intent for everyone is to stay at home. And I think that is why we chose that term specifically. We wanted to be very clear on what our expectation was to stay at home. And so those are the terminologies that we chose.
How many people does the administration believe could be pushed into poverty due to the pandemic and the restrictions on commercial activity, during these next few weeks?
I don't think that's an answer that we have right now. I think we're all very concerned, as the acting commerce director said earlier, about the impact on our communities, on people's livelihoods, on making sure that people have enough to eat, on our children, and then what are the repercussions as we go down and how do we recover. That's why I think we're anxious to see Congress act in Washington on the CARES package, and I think we remain concerned. This is not something that Philadelphia is going to deal with by itself. All of the surrounding jurisdictions, every city in the country, this will be a national recovery. This is not just a Philadelphia issue, and we as a country are going to have to be united in order to be able to overcome it. And hopefully our congressional delegates across the country understand that and remain united to vote out that package soon.
All right. And then of the 179 cases of the total, can you say how many of those were individuals who were homeless? Were there any police officers? Were there any firefighters?
Yeah, it's 175 individuals so far. Yes, 175, not 179. We're not going to be giving out occupation. We don't gather that information in general, and I'm not aware of any that are homeless.
And you can't talk about police officers or firefighters at all, because that's potentially a public safety issue in terms of how many, whether it could spread in the departments, et cetera.
No, and I don't think that is a public safety issue. Everybody should be aware that anybody out there in the city right now might have this infection. It doesn't matter if there's a police officer or anybody else who's not a police officer.
Okay, thank you.
Okay, we're going to go to Marco Serino with PA Legislative Services. Also, just a quick reminder that we do have Commissioner Frank Breslin on to answer any questions from Revenue. Just a reminder.
Good afternoon. Can everyone hear me?
Yes, thank you.
Okay, great. Thank you. First question is for Managing Director Abernathy. Will you offer a plan for the transfer funds you're seeking at Thursday's hearing?
We'll be able to provide overarching broad strokes, but we're not going to be able to get into a level of detail that we would normally for an appropriations hearing. This situation is changing rapidly and our needs are rapidly changing, whether that is identifying specific PPE needs or identifying additional sites for hospital beds or for quarantine facilities. And so we will be able to speak in large generalities and what our approach is to the use of these funds, but we're not going to be as specific as we would normally.
Okay, but will you be going over your top priorities for the funding?
We will talk through top priorities, but again, we're not going into the level of detail that is a dollar for dollar expectation that I think City Council and the administration has been used to, and the public. Again, this is going to be top line and much more general than we would normally do.
Okay, thank you. My other question was for Dr. Haidt.
Yes.
Yes, Dr. Haidt. The 2-week shutdown of schools looks like they'll be ending Friday. What have you heard from Secretary Rivera or any of the state leadership on extending the schools' closures?
While we fully expect to hear something, we have not heard anything about that yet. And so we're all looking to hear something, we hope, in the coming days.
Okay, thank you.
You're welcome.
Okay, next we have Claudia Lauer with the AP.
Hey, can you hear me?
Yes, ma'am.
Hi, thank you for taking questions. I had somebody already kind of raised a concern that we've had. The AP has been looking for information about law enforcement officials / officers who've been tested positive. We've gotten information from New York City, from Atlanta, from Dallas, from a bunch of different big cities. We were wondering if we could get the same information from Philadelphia, or if there could be a reconsideration for just a number in terms of law enforcement officers who've tested positive in Philadelphia.
At this point, we aren't, as Dr. Farley just covered, we're not releasing information on professions, and we'll certainly consider it as we go forward, but at this point, we're not going to release that information.
Okay. And then secondarily, has there been any guidance to officers about when they should self-quarantine or when they should continue to report to work specifically?
Yes, the police commissioner has issued protocols for officers to follow. There has been training done at roll call, so essentially when all officers come onto duty, and that protocol is continuously updated. In fact, there was conversations as early or as late as this morning about how and if we should be updating those conversations and that protocol.
Okay, will those be available to the media if they are updated, those protocols?
We can certainly have that conversation.
Okay. Then I am good. Thank you so much.
Next, we are going to Brian Mendoza at NBC 10 Telemundo.
Can you guys hear me?
Hey, yes, Brian. Good afternoon.
I have a brief question for Dr. Farley. Hello, Dr. Farley. Just wanted to see if you can confirm how many testing sites will be operating this week here in Philadelphia.
Yeah, I can only tell you it's going to be probably more than 20. I can't give you an exact number. As of last week, we thought it was going to be more than 20, but some of them have scaled back because of the shortage of testing capability.
And are you guys asking any other businesses to donate masks and gloves?
We have said that in the past, yes. If there are any businesses out there that have stores of masks or other personal protective equipment, which they don't need, contact us at the Emergency Operations Center, and we'll see if we can use it for all of our many needs.
Thank you.
And as relative to the donations of masks and gloves, I mean, this points out the problem that we're dealing with nationally. This should not be an issue where we're actually soliciting and begging people to donate things. These should have been stockpiled nationally, and they should be in our hands already. And that's what cities and states are up against in dealing with this. And I think it's sad that we have to beg for contributions of masks and gloves, which is ridiculous.
All right, next is Jack Thompson with Metro.
Yes, this is for Sylvie Gallier Howard.
Hi, Jack.
Hi. My question was, do you have any measures on how this crisis has affected the city's economy in terms of losses for businesses or unemployment?
So we did a survey, and we've had more than 2,500 responses on the survey in English. I know we were over 100 on the survey in Chinese, and we also had it in Spanish and French. A large portion of the responses said that they had losses between over 80% in revenue, especially in the most recent days. But certainly we've seen that businesses, also a large portion of those were businesses with under 5 employees. So we know that businesses are hard hit based on that data.
And secondly, do you know which industries have been hit the hardest with this?
Well, I think the industries where there's been a lot of closures, I mean, definitely hospitality and tourism, restaurants, retail, childcare. Those are some of the ones that stand out.
Thank you.
Okay, now we have Nigel Thompson with Aldea.
Hi, can you hear me?
Yes, Nigel, good afternoon.
Good afternoon. I also have a question for Sylvia and whoever can answer.
Hi, Nigel.
Hi. I just have a question in terms of when these small businesses apply for these emergency loans or these loans, how long should they expect to wait before they can get funding? Or how what's the turnaround time on your guys' end?
So we'll be doing reviews on a rolling basis every week, and we anticipate the businesses can hear back within approximately a week to 10 days, and we'll do the disbursements once awards are made as quickly as we possibly can. Those will be done through electronic transfer.
Okay, that's all my questions. Thank you.
Okay, thank you.
Next, we're going to Denise Clay.
Good afternoon. I had two questions. One concerned the Reading Terminal Market. Technically, that's a grocery store, but there's also places where you can walk up and order food. Is there going to be, has this been exempted from the whole, walk up prohibition? Because you can't necessarily call or order online for a lot of those places in the market.
Many of those places you can call and order or order online. And again, so we are asking all of those establishments to either develop call-in or online options. But again, and then people would go and pick up their food and pay at that point. But again, we do not want folks to be standing in line ordering.
Okay, but what about the grocery store part? Because you still have to walk up for that. I mean, you could go, I don't know if you can order from the Pennsylvania Dutch Meat Market online and pick it up there. You would
Sure.
have to go and ask what you need.
Just like any other grocery store, we would expect people to practice social distancing. Most stores have actually already put in a number of policies to both limit the number of people inside their store as well as how people are queuing to pay. And we'd certainly hope that and ask that all grocery stores, whether they're in the terminal or the Acme, to do the same. And I think we've seen good compliance with that.
Also, I had a question regarding the homeless population. I was in Center City on Saturday, and I was talking to one of the folks from the Center City district who was talking about the amount of homeless people that were still on the street. And I know that it had been talked about yesterday and earlier in the week that there was something being put in place for them. What is the status of that now that this is a stay at home, you have to be inside kind of thing?
So the homeless population was exempted from the stay-at-home order, obviously, for obvious reasons, that they don't have a home to go to. We are continuing to rapidly expand our shelter space to the best of our ability and encourage people to come inside and receive services. I think the facility you're talking about, and I referenced earlier, is a quarantine facility for those individuals who are showing symptoms, and we have identified a facility and are working on staffing.
Okay, thank you.
Okay, next we're going to Nick Cutler with the Washington Post.
Yeah, hi, can you hear me okay?
Yep, good afternoon.
Okay, great. Well, I've got a few questions that cover a few areas. The first I think is for Dr. Farley. From my understanding, it seems that the populations that are being emphasized for testing are healthcare workers and people over 60. Do I understand that correctly?
It was healthcare workers and people over the age of 50, but those criteria may change.
Okay. I'm sort of wondering, at what point do you see testing becoming more available? And if so, what are the next groups and populations and people at risk that would be in sort of like the next tier of priority?
At the rate we're going now, testing in the future may be less available because there is the limited capacity at the laboratories, there's a limited collection kits. So we're more likely to narrow the criteria than widen it. If we do, I'll just simply say we're going to evaluate this every day and we'll change our criteria depending what's available to us.
Okay, so you don't see, at some point there should be more testing, I'm guessing it. Do you just see it narrowing or?
At some point, I would hope that the supply shortages problem will be solved. At some point, this epidemic will be past the peak and on the downside of it, and at that point, testing becomes more valuable so that we can find the few remaining cases and prevent them from spreading the infection to others.
Okay, and I guess that gets to my next question about resources. The mayor had mentioned his feelings about having to, ask for masks and gloves and those donations. What are you not getting from the state or the federal government that you feel you need?
Well, personal protective equipment is the top of the list there, the masks and eye protectors, gowns. I think we're probably okay on gloves. We also laboratory test kits, laboratory testing capacity. are the top of the list right now.
Okay, I think this last question is for the mayor, but I'm sort of wondering what are the marching orders, or what's the best practices for the police who are actually going to be walking the beat? If they see 3 people congregating on a street corner, which of those 3 people expect as an interaction?
Well, each individual situation will be different. Many officers are in cars. They do have a loudspeaker system that they can engage to engage those folks on the corner. And we'd like to, again, keep our officers within the 6-foot parameter near anyone. And you can speak to a group of people from 6 feet away or more. And again, this is an engagement to continue to educate people on their responsibility to not only keep themselves safe, but to stop the spread of this disease, this virus, so that older people and others that are at risk won't die. So I'm hoping that the better angels of people being reminded, again, at this point by police officers potentially, will go in the house or put themselves where they can be out of danger and keep other people out of danger. This is not going to be kind of a hard-edged type of approach. We need to keep on talking to people and keep on explaining to people their responsibilities and the exposure that they're causing for everyone else. And hopefully, as time goes on, we can get more and more people inside.
Okay, thank you very much.
Okay, now we have someone that's calling in on an iPhone. I'm going to unmute you, but if you could identify yourself, thank you.
Can you hear me?
Yes.
Yes. Hi, it's Joyce Evans from Fox 29. Thank you for taking questions this morning. My question is a quick one for Dr. Haidt, having to do with meal distribution. We went around to a few this morning, but I was wondering, for those people who were coming to the parks or recreation sites that are now closed, will there be any arrangements made for them because they just didn't know where they were supposed to go?
That's actually, we are working on a broader food distribution plan that we hope to have in the near future that will include those parks and recreation facilities and provide better guidance.
I'm sorry, I didn't hear your answer.
We are working on a broader food distribution plan for all of our community that we hope to be able to provide better guidance. It's not necessarily just a school district issue.
So did they distribute this morning or not at the parks and recreation sites?
No, they didn't. And Joyce, that was announced last week to make sure that people were aware, and that communication went out in multiple formats.
Okay, so I think most people were just finding it out because we got a couple of calls asking, were they still able to go?
Understood, so, and I think we are all working to educate and communicate to the best of our ability, and we certainly appreciate your help in making sure that our populace and our residents know the most up-to-date information.
All right, thank you.
Thank you.
Okay, now we are going to go to Dale Mezzacappa with the notebook.
Hi, can you hear me?
Hi, Dale.
Oh, hi, how are you? So I have some questions for, I guess it's for Dr. Haidt.
Hi, Dale.
Hi, how are you? So I gather from your prior answer that you're waiting for guidance from the governor on the issue of when to make a decision about a longer closure of schools, but I was wondering if you're making preparations for a longer closure. I know you have the additional packets, but trying to get technology to students, for instance, delivering laptops. The other question I had to same sort of question about what's been happening with guidance to teachers regarding what they should be doing, or whether you're leaving it up to schools, and what you're actually, prevent or telling them they shouldn't do. And then I have one more question.
You want to go ahead and get that question out?
Yeah, I was wondering if there's going to be a Board of Ed meeting on Thursday, and if it's going to be conducted virtually, or because I know there's certain things that have to be done by certain deadlines.
Great, thank you. Thank you. First and foremost, on the long-range plans, yes, we are making long-range plans. That's why we are printing another 10 days worth of learning guides. We're also beginning to explore ways to provide technology for more young people and broadband access in the event that this goes even longer. In addition to that, we have provided new and different information to staff members in terms of things that we're encouraging them to do. We want our teachers communicating with their young people, with their classes. We want them to maintain those relationships. We want them to help young people who may have forgotten their passwords to certain things. We have provided a lot of information around the online resources that are available, and that's one of the reasons, if this goes longer, we need to find a way to distribute and get to more of our families the technology and the access to the internet. With respect to the board meeting on Thursday, yes, the board will be making an announcement regarding the meeting. Right now, the meeting is scheduled as a virtual meeting. There will need to be some action that's taken based on things that are required.
Will the public have access to it in any way?
I do not know that yet. Once I leave here, I'm going to meet with, talk with the board to actually figure that out.
Thank you.
Okay, so before we move on, I just have an announcement from my colleague Irene Contreras about the Spanish Q&A portion.
Hola, buenas tardes a los compañeros periodistas de los medios en español. Es momento de iniciar las preguntas en español. Recuerden que deben hacerlas utilizando la función raise hand o levantar la mano.
Okay, thank you, Irene. We do have one more question, it looks like from Sean Walsh at the Inquirer.
Thanks. Sorry, just one real quick follow-up for Dr. Farley, actually. Just to clarify, when you report the daily number of hospitalized patients, is that all people who have been tested only, or does it also include people who are presumed to have it because of symptoms but haven't necessarily been tested?
No, those are people whose tests are positive and we know that they're hospitalized. I should be clear that those are the ones that we know that are hospitalized. There may be additional ones that we're unaware of at that time, and the numbers will increase as we get further information on the new cases.
I'm sorry, I didn't mean to talk over you. Does that mean that there could be additional cases of people in the hospital who haven't had the test, but they're in the hospital because of coronavirus?
Yes, there absolutely could be people in the hospital who have not had a test result back yet. If hospitals see patients that have symptoms typical of this, then they'll send tests off, but there's a delay till they get the result back.
Okay, thank you very much.
Okay, we are going to move to our Spanish portion. So I'm going to unmute, it looks like Brian Mendoza with NBC 10 Telemundo.
Hola Silvi, buenas tardes.
Hola Brian, ¿cómo está?
Bien, bien, gracias, gusto en saludarte. ¿Podrías brevemente explicar este fondo que está disponible para los pequeños negocios en cuanto a quiénes pueden aplicar y desde cuándo?
Entonces hay 3 niveles para el fondo. Hay el nivel para microempresas, que es para empresas hasta $500,000 de ingresos anuales. Después el segundo nivel es para pequeñas empresas entre $500,000 hasta $3 millones de ingresos anuales. Y luego hay préstamos con 0% de interés, y esos son para negocios que tienen un ingreso entre 3 millones hasta $5 millones anuales.
¿Desde cuándo pueden aplicar y cuánto es la cantidad que cada negocio puede obtener?
Desde ahora ya está en vivo. De hecho, ya creo que hay más de 15 aplicaciones. Y la otra pregunta, el primer nivel es para microempresas, son $5,000. Para el segundo nivel es hasta $25,000. Y para el tercer nivel es hasta $100,000, y eso es el préstamo con 0 interés.
¿Y estos son para negocios para que cubran gastos o dinero que no han podido recolectar o...
Sí, la prioridad realmente es que traten de mantener sus empleados, pero también para gastos como la renta y cosas así.
Y ¿hay tal vez algún plan o esto también se implementa en este plan para ayudar a inmigrantes indocumentados que no pueden aplicar para desempleo y que estén básicamente sin dinero porque el negocio cerró, no pueden ir a trabajar?
¿Está hablando de inmigrantes que tienen negocios?
No, eso o también inmigrantes indocumentados que trabajan para negocios que están cerrando.
Pues este programa es para negocios, entonces la idea es que va a ayudar para los empleados también, pero realmente los fondos van directamente a los negocios.
Ok. Y empezó, ¿cuánto es la cantidad que tiene en total el fondo?
En total es un poco más de 9.2 millones de dólares.
Ok, ¿y dónde pueden ir para aplicar para este tipo de ayuda?
Es www.fila.gov, raya inclinada, COVID, raya 19, raya Business Relief.
Business Relief.
Y la solicitud está disponible en español.
También en
Se la
español.
puede llenar en español.
Ok, listo. Muchísimas gracias. ¿Algo más que quiera mencionar que tal vez no hemos...
No, solo que nosotros realmente priorizamos a las comunidades indígenas y, inmigrantes, entonces por eso tenemos todo disponible en mandarín y también en español.
Ok, listo. Muchísimas gracias.
Gracias.
Okay, I think that concludes our conference. If you have any other questions, please email press@phila.gov. Thank you.